This video is going to cover the basics of the biology of fertility. Okay, and by the time we finish this, you guys should have an understanding of what is meant by continuous and cyclical fertility, what we mean by the term fertile period, and how that information can be used to calculate the best chance of conception. And at the end of this, we'll do a case study. Okay. Now, before you watch this video, it would be helpful if you use the PowerPoints that are posted to complete pages 35 and 36 of your notes. So if you haven't done that, can you please stop the video just now and go and do that first? Okay? Right, so men have got continuous fertility because men are constantly producing sperm from puberty throughout the whole of their life. However, women are only fertile for a couple of days each month throughout their menstrual cycle, so therefore fertility in women is said to be cyclical. So you can see on this diagram showing the menstrual cycle, remember we have the follicular phase, which is the part of the cycle prior to ovulation, then we have ovulation, and then we have the luteal phase, which is what we call the cycle after ovulation. Okay. For females, it's only possible to conceive round about ovulation. Right? Remember, the egg only lives for about 24 hours. So there's only a 1 or 2 day window where women are fertile. So that's why we call it cyclical fertility. So, if a couple are trying to get pregnant, it would be useful for them to be able to work out where this window, where it is possible to get pregnant, will actually fall within the menstrual cycle. And there are several ways that they can do this. This can be done by monitoring their temperature, the consistency of their cervical mucus, and by looking at these signs and symptoms, you can get a good idea of when you're most likely to be fertile. So let's deal with temperature measurement first. Okay, so if a couple are trying to work out the best time of the menstrual cycle to get pregnant, one of the things that they will do is that the woman will monitor her body temperature regularly to look for any changes. And one of the key things to look out for is that following ovulation, a woman's body temperature will rise by about 0.5 degrees Celsius. Okay. And this is due to the secretion of the hormone progesterone. Progesterone is what we call a thermogenic hormone. It increases the body temperature slightly. Okay. After the 3rd day of elevated temperature, the fertile period has passed. So if we have a look at the graph, you can see that during the follicular phase, the body temperature is hovering at around about 35.5 degrees Celsius. Okay. However, you can see then on day 15, there has been quite a steep rise in the body temperature. So we've had this 0.5% rise in body temperature. So that indicates that ovulation has taken place round about day 14. The empty follicle has become the corpus luteum, which has started to secrete progesterone, and the progesterone then causes that increase in the body temperature, and the body temperature remains high. So if we count the days 1, 2, 3 days past ovulation, 3 days of elevated body temperature, so by this day here, day 17, the fertile period has passed. Okay. You can also see that towards the end of the cycle, the body temperature starts to fall, and that coincides with the degeneration of the corpus luteum. Falling levels of progesterone means that the body temperature falls, and that would be a signal that menstruation is about to start. Another way in which a woman can monitor her fertility is to look at the cervix. Okay, the cervix secretes mucus, and as a woman approaches ovulation, the high levels of estrogen being produced by the follicle stimulates the mucus produced by the cervix to become thin and watery. It has an identical consistency to semen, and that means that the sperm can easily pass through the cervix. This then increases the chance of the sperm swimming up through the cervix into the uterus and increases the chance of fertilisation. Okay, so you'll notice that on the chart here, that around about ovulation, the mucus secreted by the cervix becomes wet, slippery and stretchy, and its consistency becomes a little bit like that of egg white. Okay, now these lovely pictures here show the different consistencies of the cervical mucus. All right, so the fertile mucus is this one here, the picture on the bottom right. You can see that it's clear, it's stretchy, it does indeed look like egg white, and that is what we call the fertile mucus. That's the one that the sperm are most likely to pass through. Okay. After ovulation, the progesterone causes the mucus to become thicker. Okay, and this is really important, particularly during pregnancy, because the mucus plug that forms in the cervix helps to prevent the developing baby against infection. Okay. Right, other things that can happen, although you're not actually required to know this for the course, is changes to the consistency of the cervix. The opening of the cervix is called the os, and for most of the menstrual cycle, the os is tightly closed. However, just before ovulation, the cervix will become softer, the os will open to allow sperm through. And that coincides with the fertile period. Right, so this shows an example of a chart that a woman might keep if she is trying to get pregnant, okay? You can see that the temperature is being recorded every day, right? Now, the temperature needs to be recorded at the same time of day, in the morning before you get up, before you do anything, for it to be reliable and consistent, right? So you can see here we have got the rise in temperature following ovulation, okay? You can also see along the bottom here that she is recording the consistency of the mucus. So at the start of the cycle, that would indicate the menstrual flow. And then once menstruation has finished, D represents dry days, so no mucus. And then she's charting the changes in the mucus as we go through. So from thick and sticky to becoming thinner and slippery and the fertile egg white mucus, and then back to becoming thick and sticky again. Okay, and then you can see that there are other symptoms that are noted on the chart as well, and these ones would be to do with the onset of menstruation. Okay. Right, so what you guys can do now is you can go to your notes booklet and you can have a go at the case study on pages 37 and 38. So pause the video, do the case study now, and then come back and we'll discuss the answers. Right. So you've got all of this information about Sophie, about the signs in her cervix and the mucus, okay, and the fact that she took her temperature at 7 AM every day, and we're making a chart to predict when Sophie's fertile period is. So, here we go. This is what we should have noticed. So, with the mucus, we have got P for menstruation. D from days 6 to 8 means no mucus is produced. SM for days 9 to 11 is sticky mucus. And then days 12, 13 and 14 are fertile mucus. Days 15 to 18 are sticky mucus, and then days 19 to 28 are dry before the menstruation starts again on the 1st and the 2nd. Okay. For the cervix, open for days 1 to 5 because that is her period, closed again up until day 11, open round about ovulation, and then closed from days 16 right the way through to day 28. Okay. The blue from days 1 to 11 represents the follicular phase. 12 to 16 represents potential days for fertilisation, and then the yellow represents the luteal phase. Right, Sophie is most likely to ovulate on day 14. Okay, the egg is likely to live until day 15 or 16, depending exactly when on day 14 she ovulates. The earliest time for intercourse to result in pregnancy is on day 9 or 10. That's because sperm can live in the female reproductive tract for up to 5 days. Okay. The latest time for intercourse to result in pregnancy is on day 15 or 16. It depends exactly how long the egg is viable for. Okay. Saturday the 7th, it would not be possible for her to get pregnant. On Monday the 16th, it is just about possible, depending on whether the egg is still viable or not. And then on Friday the 20th, it is not possible. If she had intercourse on the 19th of March, which had been infertile in February, and she became pregnant, suggest a reason for this. Reason for this is that the follicular phase can vary in length from month to month. This can be due to stress or illness or being on certain kinds of medication. That means the follicular phase could be longer or sometimes shorter than it would normally be. Okay, so that's the end of this first video. If you're needing any more help, please contact your biology teacher, or alternatively you could use BBC Bite Size or Scholar for some additional support.